Here's what most patients and caregivers don't realize. Medicaid NEMT, non-emergency medical transportation, is about to change in ways that could directly affect you or someone you care about. And unlike a lot of healthcare news, this one requires action now, not later. My name is Navdeep Maju. I've been in medical transportation for 20 years, and I'm going to walk you through what's actually happening, who it affects, and what you need to do about it. Let's start with the facts. As per industry analysis from RouteGenie, Medicaid is tightening NEMT contracts significantly in 2026 and beyond. Here's the critical part. Proposed Medicaid funding changes could remove approximately 10% of people from NEMT eligibility over the next decade. That sounds abstract. Let me make it concrete. If you or a family member relies on Medicaid to pay for transportation to dialysis 3 times a week, or mental health appointments, or hospital discharge follow-ups, this affects you. If you can't drive, don't have reliable transportation, or have a chronic condition that makes independent travel unsafe, this policy change is directly relevant. Why is this happening? Medicaid is under budget pressure. The states that administer Medicaid programs are being forced to make cuts. Meanwhile, older populations are growing. We're looking at nearly 73 million Americans aged 65 and older by 2030. That's more people with chronic conditions, more hospital visits, more demand for transportation they can't provide themselves. But the funding isn't scaling with demand. So instead, Medicaid is narrowing who qualifies and tightening which trips get covered. The second pressure is this. Medicare Advantage plans, those are private insurance plans that some Medicare beneficiaries use, are dropping transportation benefits. According to the Kaiser Family Foundation, coverage dropped from 36% of plans offering it in 2024 down to 24% in 2026. That means more people who thought they had coverage no longer do. So who's actually at risk? If you're on Medicaid and you depend on NEMT for routine care, pay attention. If you're a caregiver managing transportation for an elderly parent or a family member with mobility challenges, you need to understand what coverage actually exists before it changes further. And if you work in healthcare, if you're a social worker, discharge planner, or care coordinator, your patient's ability to reach appointments is now genuinely uncertain. The timeline matters too. These changes aren't all happening at once. Some states have already tightened Medicaid NEMT eligibility. Others are implementing changes through 2026 and 2027. But the trajectory is consistent. Fewer people covered, stricter qualifying rules, and potentially longer wait times for rides that do get approved. Here's what you actually need to do right now. First, contact your state Medicaid program directly. Don't assume your coverage stays the same. Ask specifically about NEMT eligibility in your state for 2026. Get the answer in writing if you can. Second, if you're managing care for someone else, document their current coverage. What rides are covered, how often, which providers are approved. That documentation is your proof if coverage changes and you need to appeal. Third, talk to your healthcare provider. Your doctor's office or hospital discharge planner often knows state-specific coverage rules and can advocate for medically necessary transportation on your behalf. Fourth, explore alternatives now, not when you need them. Some states offer ride-sharing programs, some nonprofits cover gaps, some transportation providers offer sliding scale fees. Find these resources while you have time, not in crisis. NEMT policy isn't glamorous, but reliable transportation to your appointments is the foundation of every chronic condition you manage, every treatment you complete, every doctor visit that prevents an emergency room trip instead. If this video helped you understand what's changing, share it. Your family, your community, the people you care about, they probably need this information too. We are Beyond Ride. Stay informed, stay prepared. Book a ride with us at beyondride.com.